I'm doing great. So how long have you been a nurse?
25 years.
Wow. And what is it like to be a psych nurse?
Interesting. Every day is different. Sometimes it's very calm, sometimes it's very crazy. But the most important thing about being a psych nurse is that one always operates safely. And the way one does that is by having standard operating procedures.
Mm-hmm.
It's all about boundaries and limitations.
Mm-hmm.
And everybody has to enforce the same boundaries because psych patients typically are very manipulative and they will staff split, and if we don't all adhere to the same standards, then we create problems for ourselves, for the unit, and for all the patients.
Wow, thank you. And what are the requirements to become a psych nurse?
Well, back in the day, all one needed was an associate's in nursing. I went the med-surg route first, and then I just transferred to this department. So really it was to have an RN license and to be willing. Of course, nowadays one must have a bachelor's. You can also get certified as a psychiatric nurse. But I was lucky enough to be trained by some very senior, experienced nurses, and I worked at night, and they had about 150 years experience between them. So they had a lot of knowledge, and they taught me most of what I know.
Awesome. And do you regret anything or wish you would have done things different as a nurse, like a different career path or from where you are right now?
When I wanted to become a nurse and during nursing school, I was interested in being a surgical nurse, but I never wanted to be on call. So I never pursued that route because that is a requirement. Kind of happened into psychiatric nursing because one night they didn't have a nurse and I was working med-surg. And the program director at the time called over and asked for anyone to volunteer, and I was the only one. So my first night on a psych unit, I was the only nurse. And I really didn't know anything about psych, but she gave me the most experienced techs, and she told me I wouldn't have any admissions, and I didn't have to write any notes, and she gave all the medications. So I really just babysat the unit with 3 very experienced techs, and it was a safe and interesting evening that kind of piqued my interest.
Awesome. And were you born here in America?
No, I was born in the United Kingdom.
And how is it over there? Like, what's it like to be a nurse over there in New England?
Well, medicine is very different in the UK because it's socialized, which means the government funds it and it comes out of people's taxes. So it is not run for profit. There is a lot less elective procedures. It's really more emergency type services. So sometimes, like for knee replacements, hip replacements, you have to wait for a long time. But it's good care, but you might not get it as soon as you would as in the United States. Nurses also are less technical there. They don't have as much scope of practice as we do.
No.
It's kind of more like a cross between a nurse and a tech, and they have a lot of open wards where there might be 30 patients on a ward and a couple of nurses. So it's a harder job in many ways, and it is not as well paid because it's not a for-profit industry.
Thank you for that, Fiona. And my last question is, what advice do you have for nursing students and for this career path, like if they do choose to be a psych nurse?
I think that it is very good to get medical experience first, because whatever kind of nursing you do, you're going to need medical experience. And even on a psych ward such as in Key West, where we are not physically attached to the medical facility, we receive a lot of medically compromised patients. So it is very helpful to have medical knowledge first.
Very, yes.
But the great thing about nursing is that there are so many career choices. There are so many schedules you can work. So I would say get your medical experience first, and then try psych, if that's an option. That's not to say you can't go straight into psych, but once you've done medical, you have a lot more options available to you. If you go straight into psych, it's harder to get out of because you don't have medical experience.
Very true. Well, thank you so much for your time, Fiona. Hey, Jo. How are you?
Good. Hi, my name is Jo. I'm an RN here, and Cheryl is going to be helping me out, and we're just going to give you guys a quick overview of restraints. So first off, we do have 4-point restraints here at the POO. We have 2 different types. This is our restraint room. It's located behind the nurse's desk, primarily so we can keep a close eye on the patients. Restraints is the last thing you will ever do to a patient. You always want to go with the least restrictive measure. So if you get to the point where you have to restrain a patient, you have exhausted all other options. So at the point where if you feel like a patient needs to be restrained, it's really to stop them from being an immediate danger, physical harm to themselves, others, staff. You're unable to verbally de-escalate the patient. Medication hasn't worked. You can't identify, are they in pain? Are they anxious? Is there another reason? Is there an alternative? So they are physically a danger to other patients, staffs, or themselves. So typically we would have all staff, we would call code gray onto the unit. Every staff member would have an assigned role. So we would safely get them into here, into our restraint room. Cheryl, do you want me to undo these, or you just want to scoot down for me, hon? All right, so with restraints, obviously we would have more staff members, and you try to gently restrain the patient as, easily as you can. Ours are Velcro restraints, and so you can see here, they're pretty simple to use. You just quickly want to do the Velcro, and obviously you want to feel. You don't want them so tight that they're going to cut off the circulation. And then they just clip in, and you would do, each limb. With that, I would remove her shoes. You're going to check for pedal pulses. You don't want this restricted, cutting off circulation. While a patient is in restraints, the biggest risk is obviously, they can move around, they can damage their tissues, they can injure themselves, they can thrash about, skin breakdown, injuries. Patients have actually had like asphyxia. You really want to watch their positioning. Once they're in restraint, someone has to watch them one-on-one, nonstop, make sure that they are safe. While they're in restraints, we do skin checks frequently, vital signs frequently. We offer toileting, fluids, all of those needs. So, any questions?
I think that's it. You let us know on the info here. Thank you for your time, Jo.
No, you're welcome.